What could you do to protect your pets if you're sick or injured? My product, Save My Pet ID tag, helps you ensure that your beloved pets are safe and well cared for, even when life isn't what you expect.
There's a trend going on. More and more pet parents are opting to say goodbye to their pets, not inside a veterinary exam room, but actually in their own home. There's a growing demand for compassionate, knowledgeable veterinarians who can perform at-home pet euthanasias. And go ahead, grab the tissue box, but this is supposed to be an empowering. This is going to help us all. And the person here to help us is one such veterinarian. She is Dr. Megan Metter, and she is from Lap of Love. Welcome, Dr. Megan.
Thank you. I'm glad to be here.
All right. You say the word euthanasia, and all of a sudden people just stop in their tracks. But what's your take on euthanasia?
My take is that euthanasia is one of the most beautiful and compassionate gifts that we can give our pets. These pets give us a lifetime of love and companionship and joy. And when we bring these guys home, just like your human children, you have the responsibility that you're always going to do what's best for them, always going to make the decision that's in their favor. And euthanasia is just that. When they're old and their quality of life is no longer there, when they're suffering from pain or chronic illness or even acute illness, and that suffering is just not going to get better, euthanasia is that last compassionate gift that we can give them that is truly doing within their best interest to end their suffering.
So, Dr. Megan, what the heck is Lap of Love?
So Lap of Love is a network of doctors across the country. And as you said, we're not in all states, but we're in most states where you can call us and set up an appointment, and we will actually have a doctor come out to your home and put your pet to sleep in the comfort of your own home. And we're not just about the actual process of giving the drugs. We actually are there for you every step of the way, from the moment that you call in and you're not really sure what to do or what the next steps are, to helping guide you through end of life discussions, to that actual moment where you say goodbye, to the aftercare of your pet, to even helping you through pet loss support and bereavement and grief and that sort of thing. We help you through the entire process. And our goal is to keep you out of the clinic setting for euthanasia so that your pet can pass in the comfort of their own home in their favorite spot with their favorite people around them.
Well, let's talk a little bit about yourself, because you are a veterinarian and you graduated from one of my favorite vet schools, Tufts University. Tell people your backstory, because they're going to be curious how you went from one field of veterinary medicine to this one.
Yeah, so I kind of jokingly say I went from one end of the spectrum to the exact opposite. When I was in vet school, like you said, at Tufts University up in Massachusetts, I knew that I wanted to be an emergency veterinarian. So I kind of worked everything in that direction. I did an internship, which is extra training. We're not required to do one, but I chose to do one. After school, I did an internship in rotating small animal medicine and emergency care. I went from that into a job in emergency medicine. And I worked in South Florida and Southwest Florida my entire career. And I worked at several different hospitals, but essentially my job at each one of those hospitals was as an emergency and critical care veterinarian. So I'm the one that if your dog unfortunately gets really sick or gets hit by a car or needs emergency surgery or something like that, I'm the person that you would see, and I would help get your pet out of that immediate crisis and hopefully transfer your pet into the critical care and intensive care that they needed. And I did that for 12 years and I loved it. I loved the pace. I loved the intensity. I loved all the cool stuff that I got to do. But towards the end of that, I started to suffer from really significant burnout to the point where I just didn't really want to be a veterinarian anymore.
It's not good. That is not good.
Exactly. When you spend your whole life working towards your dream, your everything, and then to decide that, oh no, I don't want to do this anymore. So I started looking for something else that I could do in another way that I could make an impact. And at the time, this was during COVID.
Oh, the fun time in our lives.
Yeah, exactly. So I was looking for a way to get out of the hospital setting and do something where I could work in a completely different setting. And Lap of Love, where I live in Florida, that's where Lap of Love started. And so they've been around for the majority of my career, and I'd always referred clients to them and had really good positive reviews coming back. So I thought, what the heck, I'll try it and see how it goes. And I did not realize that I would love doing it as much as I do. I really enjoy my job. I feel very fulfilled doing it. It's such an important feature of our life with our pets that often gets overlooked, I think. So it's good to kind of shed some light on that end of the spectrum rather than the hero swooping in to save the life.
You traded your Superwoman cape for a very compassionate hug, right? I mean, you're there. This has got to be a little dicey, tricky for you. I don't want to say the word dicey. This has got to be a little tricky for you because you're coming into a home and you may not know this animal that is ready to say goodbye. But you're a human being. I don't think you're AI, are you? Right?
Most of the time, no.
So, I mean, you got to size up the family.
Right.
And you're kind of a grief counselor for them, but you're also a medical professional to be able to make sure that the euthanasia is going painless and without hurt to the animal. Can you please talk about how Lap of Love actually has some protocols and medicine that actually makes the process pain-free but compassionate?
Yes. So we typically give one injection that puts your pet under anesthesia very quickly, within seconds. And then we typically give the euthanasia injection very quickly after that. So
that's in the clinical setting.
Correct. Yeah. And so what you experience as a pet owner is very quickly your pet goes from here to not here very quickly. Yeah. And I didn't realize how traumatic that can be for families until I started talking to them in this setting and talking to them when they're now on the other side from what I've experienced and finding out that they just don't like that. It's very upsetting. What Lap of Love does is we have a set of drug protocols that we use. And obviously this is tailored to each individual patient as necessary. Right. But when I come in the home, I typically do spend some time both medically looking at your pet, listening to your discussion, but also, like you said, kind of from the interpersonal side, sizing you up. And that sounds very derogatory. And I don't mean it to, but
looking for signals, you're doing your job. Yeah.
Reading people. Yeah. Which is definitely something I learned from emergency medicine, being able to go into an exam room very quickly and say, like, your pet is very sick or very injured, and I need to know where you're at right now as far as what you want to do. And so I learned a lot from that cape and that hat that I can now apply here in this setting where I can typically read people pretty quickly. And I think all of us at Lap of Love do get good at that pretty quickly to try to figure out where you're at, where you're coming from, what your story is, what your pet story is, and trying to guide you through that decision. So I do spend some time doing that before we even move to the euthanasia stage. And it's typically as much or as little time as the family needs to kind of guide them through. It's okay, saying it's okay. This decision is the right thing to do for your pet. But once we get to the medical side of things, typically what we do as far as medicine goes is we give a cocktail of drugs as an injection. I usually give it intra-pet. So under the skin, into muscle, really however I can get it into your pet with the least amount of stress and anxiety as possible. And that cocktail of drugs typically puts them under anesthesia within about 5 to 10 minutes. So what you as a pet owner get to see is your pet drifting off to sleep very gently, very smoothly. So your pet goes from being awake to drowsy to under anesthesia and then gone.
I like that.
So it's a much nicer process.
We're speaking with Dr. Megan Medar, and she is with Lap of Love. And wow, I've never had it explained so well as you just did. We're going to talk more after we take this quick break, so stay. We'll be right back.
Hey, have you heard? Four-Legged Life has a new digital newsletter. Here, let me show you how you get yourself subscribed. So you just type in Four-Legged Life and that'll take you to the website. There we go. And this magic thing just appears, and you type in your email address. I'll use, let's see, how about coolestdogever@gmail.com. That's me. And then you just click on this thing here. There you go. It's the new digital newsletter from Four-Legged Life. Get subscribed today.
I'm your host, Arden Moore. There's this gal in South Florida, and she's a veterinarian. She's a damn good one. She's also a proud pet parent. Dr. Megan, what's the four-leggers at your house?
So I have 2 dogs, 3 cats, and 2 guinea pigs at my home.
Okay, so never boring, right?
No, never boring. They keep me busy.
And also, when you were going to vet school, because you are also a pet parent, you're a veterinarian, but you're a pet parent. Can you share about the bond that you had with a one-eyed cat named Simon?
One-eyed Simon was the best. So I adopted this kitty when I was a student technician in the Tufts ER. And Simon was a kitty that a Good Samaritan found on the side of the road after what we think was a hit by car incident. He suffered head trauma and a little bit of brain damage, and he ultimately lost one of his eyes because of it. But I adopted him before the loss of his eye. But after the recovery of his head trauma, he was a black long-haired cat, roughly a year old, and I named him Simon. He became my vet school buddy, and we were glued at the hip. He traveled with me. He moved with me from home to home. When I graduated vet school, he graduated too. We called him Dr. Sir Simon. I actually have a picture somewhere of him wearing a little doctor costume that was really cute. But he was with me through everything, and he was such a formative experience for me. He was with me through a lot of trauma in my own life, a lot of difficulties. Like I said, he moved with me from graduation to my first real grown-up job, moving from Massachusetts to Florida and multiple homes in Florida. He was with me through marriage, through divorce, through starting new jobs. Yeah.
A touchstone, that's for sure. I want to ask you, because this is something that you could share from one pet parent to another. I know you're a veterinarian, but you decided to do something to memorialize, to commemorate your life, your years with Simon. Can you share what you did?
Yeah. So I've been working for Lap of Love for about a year when I had to say goodbye to Simon. And I was so grateful that I could do it at home as opposed to taking him to one of my friends in another clinic. And so I did decide to let him go at home. I did have him cremated and have his ashes returned back to me. And I took some of his ashes and sent them to a jeweler who had a ring made for me. And it's very simple, very dainty. It's a silver ring with a chalk through the center that has some of his ashes mixed with blue quartz stone. And so I wear that on my right ring finger. I never take it off. And it's the way I feel connected to him even after he's passed.
I like that, which gets me to this point. You, at Lap of Love, you do perform the euthanasia at home. As you said before, you don't stop there. You keep in touch with people. I understand you even, on the anniversary of the passing, what does Lap of Love do?
We even send you an email saying that we are just thinking of you. We know it's been a year since your pet passed, but we're here for you if you need anything.
So what are some other ways that you could offer to give people ideas on how to commemorate this life you had with your pet after euthanasia?
The creativity has no bounds, honestly. And I think, just going on Etsy, not to plug Etsy in particular, but things like that, where you have lots of different creatives that are out there. Anything your heart desires, somebody will make it for you. I have seen simple things that don't necessarily involve like a piece of the pet, so to speak, things like photos, wind chimes, garden stones, things like that. I've seen people have some of those stuffed plushies made that look like their pet. Sometimes the makers will even make a place where you can put fur or something like that inside of the plushie so that it does have a piece of your pet, so to speak. Jewelry, like I said, I had a ring made with my kitty. I also had, prior to that, before there was the proliferation of what you can have available now, my 2 childhood dogs, I had Pandora beads. for a bracelet
Oh,
made with
nice. Yeah.
their ashes in it. Obviously, I'm a fan of the jewelry, so because
I think so.
I can wear them with me all the time. You can see I have Simon's ring on right now. So,
Yep.
Yeah, I had one family who asked me to shave. They had a beautiful American Eskimo dog with big fluffy white fur. They asked me to shave a large section of fur and return it to them so they could have a little felt figure made with the fur, like the actual fur of the pet. So I thought that was really cute. So yeah, like anything your heart desires, there's somebody out there who will make it for you.
You also recommend that there are some places how people can deal with the grief, whether it's like in person, online. What are some of the things that Lap of Love will steer people for that? Because after it, you're still grieving.
We are, and it's okay. We grieve our pets the same way we grieve people. We go through the exact same process in our brains, and it's normal for grief to have no timeline, but it's also normal for it to take a really long time for us to get through it. And one of the unfortunate things about grief is that it can be very isolating. So it's important to know that there are people out there who can help you and help either be professional support or just be peer support, people who have gone through it just like you. Lap of Love has a very robust grief support system. We have a lot of resources available on our website, even for people that don't euthanize their pet through us. You can go on the website and find those things.
Nice.
It's lapoflove.com. But we have a Facebook group where you can go in, and we've got both people, like I'm a member of it. We've got people who have lost pets. We've got veterinarians. We've got our actual peer support people through us that are on that Facebook group that can help talk. We have Zoom meetings where you can go in and schedule a Zoom meeting that's kind of like a group therapy session or a group support group. We also have where you can actually pay for a session with one of our grief support counselors that's one-on-one. And these are folks that are specially trained in both grief support and pet loss support.
I love it.
So they know the intricacies of dealing with the fact that we're talking about a pet, and that can be very similar, but also very different to talking about a human. So we have just so many resources available. And like I said, we think it's so important that we offer those things, even to people who don't come through us as quote unquote a company. So,
well, I'm got to also address the elephant in the room. So again, how do people find Lap of Love? I know you're almost in every state, but can you steer us?
So the best way is lapoflove.com, LAP as in Paul of love. You can go on there, you can type in your zip code, and we will show you what veterinarians are available in that area. If you're in need of services, you can give us a call. We have a chat feature on our website that you can chat and also find help that way. If you call us and we don't have availability, we'll actually steer you towards other at-home euthanasia companies who might have availability who are in your area. So
I like that.
Yeah, it's not just about us. It's about trying to find what's best for you and your pet. So the website, like I said, is the best way that can steer you towards a Lap of Love vet in your area.
What quality, or what have the pets in your life, like the Simons, how have they made you a better person, Dr. Megan?
Oh man, every pet's a little bit different. Everyone's a little bit different. I think Simon's taught me a lot about perseverance. Just hang in there. There's always something. There's something to live for.
Hey, everybody. We've been speaking with Dr. Megan Medar. She is with Lap of Love. I hope one day to get to meet you in person, but I do want to salute you for all that you're doing. This is something that is beautiful, and it can be memorable, and it can be pain-free. So I have 3 cats and 2 dogs now. I've gone through the process. I've done an at-home, and I've done in a veterinary clinic setting. And I do like the at-home. So I'm just grateful that we have options now.
Yeah, thank you. Thank you. And thank you for all that you do, too.
Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life. Four-Legged Life. Make sure to subscribe so you're up to date with all of our Four-Legged Life content.